The challenges I faced as a woman in medicine were comprised of two things. One was struggling with my expectations that I had accepted I should be burdened with because I was a woman. And the other was trying to deal with expectations that were being placed on me about what my role was. And I think most women can relate to it in the sense of you're more worried about being liked than being assertive. You are often the outsider in the group. There were many instances where I was the only female, except possibly the patient. I think there were times when I found out, for instance, that the men were going off to play basketball and I hadn't been invited. And the realization that there was networking going on, or there were deals being cut, or promotions offered, or information passed along. And because I wasn't in that informal environment, it hadn't come through to me. And so you have to struggle with knowing that's going on, and then also deal with how you're going to process it and react to it. Because that's another part of the challenge, learning about it and then figuring out how to respond. And I think most women in fields that are professional, at least in our generation, could relate to what I'm saying. So what encouraged me to move into a leadership role, and what barriers did I face? I think I was encouraged by the challenge of bringing changes that I felt were necessary and doing things that I thought was a perspective that would be beneficial to the organization and our profession. And I wanted to put that perspective forward. The barriers that were there is a very common one. Women are often valued for their input, their work effort, their insights, and their presence. And yet that sometimes and very often doesn't translate into, we want you to assume a leadership role. And so I had to overcome the expectation that you're here to help, but you're not here to lead. And that was something that I think did meet a little bit of pressure. It wasn't personal, but I think it was a cultural barrier that had to be overcome. And I do think women have to be aware that when they are thinking of leadership roles, to recognize that if they're valued as a contributor, that means they should think of themselves as leading. Advice for women considering leadership roles: trust in yourself, have faith in yourself, empower yourself. Don't wait for other people to give you permission to strive for the position or to try to achieve the goal. Say to yourself, I'm good, I can do this, and I'm going to go for it. The other thing is to reach out to people who you know will support you, or who you can talk to, who will understand the challenges that you're facing, and who can be there to tell you go for it. Because I think it's accepted sometimes that males will compete against each other, they can be assertive, maybe even aggressive, and that's competition on the field of play, and it's acceptable. I think women are sometimes given the message, if you're too aggressive or too assertive, you're offending people, you're not being the nice girl, and someone may not like you. And I think women have to have a little more of a sense of, you know what, assertiveness is a positive quality. Confrontation is part of how an organization may grow, and women have to be willing to put on that mantle without feeling like they're abandoning their femininity. What did it mean to me to be involved in the first meeting of the Women's Caucus this weekend? I was absolutely thrilled. It's something that in retrospect should have happened years ago, but it wasn't until Dr. Sherry Blumenthal came and had the vision to say, you know what? We have similar experiences, we have similar perspectives, we have diverse experiences, we have diverse perspectives, but we share one thing: we're women, and maybe we need to meet and start thinking in terms of what we share and what we can bring as a group and a perspective. And the meeting was so dynamic, and the ideas were so wonderful, and the collegiality and the commonality and the excitement in the room was palpable, and I think everybody is truly thrilled, and part of me says, why did this take so long?